but yeah.
Okay. Hi, everyone. My name is Caitlin Miller, and I'm working at the Iowa Heart Foundation as the Heart Corps service member. The Iowa Heart Foundation is a nonprofit organization started over 30 years ago by the physicians at the Iowa Heart Center. And as an organization, we focus on heart health education and heart disease prevention across Iowa. I'm happy to introduce today's speaker, Jami Haberl, Executive Director at the Iowa Healthiest State Initiative, and today she will be discussing the 5210 approach and double up food bucks. So I will now hand it over to Jami.
Hey, thank you, Caitlin. Oh, looks like I need access to share. Oh, here we go. Okay. Get everything set up here so we can all see. Can you see just the normal presentation part, not the notes part, right? Okay, perfect. Well, thanks so much. Thanks, Caitlin, for having me today. I have just some slides here that I thought I would share a little bit about the Iowa Healthiest State Initiative. I'll talk about the programs that we have that includes, like you talked about, our 5210 Healthy Choices Count and the partnership we have even with Iowa Heart, as well as some other of the campaigns that we're working on to really improve the health of Iowans as well. So our vision is we are a 501c3 nonprofit organization. We were launched in 2011, and our vision is that every Iowan has the opportunity to live their healthiest life. And we do that through our mission of creating awareness and integrating solutions to improve the physical, social, and mental well-being of Iowans. We have several investors. A lot of people think Iowa Healthiest State Initiative is funded by the state of Iowa, or that we are a state agency. We are not. We are actually primarily funded through private sector partners throughout the state of Iowa. So I have to give them a shout out for their initiative to continue to support the work of the Iowa Healthiest State Initiative. Just a little bit about who our staff is. We have 7 full-time members here that you can see on the screen, really leading the work of the Iowa Healthiest State Initiative, from everything from our marketing to our events to our donor engagement, and then obviously our program work that we have here in the state. So we do have, I would say, 4 campaigns that we really work on that is working to improve the health of Iowans. And I'll go through and provide a little bit of an overview of each of these and how that really ties back to our ultimate mission and vision of creating those awareness opportunities, but then really integrating some of the different solutions to support that every single person can live their healthiest life. So I'm going to start off, and hopefully the video will work. You never know with technology, but I'm going to start off with talking about double up food bucks. And so I'm going to do that with using a video today.
Welcome to Double Up Food Bucks, Iowa. Imagine going to your local grocery store, farmer's market, or farm stand and getting double the value for every dollar you spend on fresh fruits and veggies. Sounds great, right? Well, with Double Up Food Bucks, it's possible. Here's how it works. When you use your SNAP EBT card to buy fresh fruits, veggies, or even plants and seeds that grow them, you get double your money, up to $15 each day. You can use these extra bucks to buy even more fresh fruits and veggies. It's a great way to stretch your food budget and help support local farmers and grocers. You can earn more double up bucks every time you shop for fresh fruits and veggies, or you can save them for later. It's a win-win-win. You get more food, eat more fruits and veggies, and help your local community. Ready to start? Visit doubleupiowa.org to find a participating site today.
So Double Up Food Bucks is one of our key programs that we have launched back in 2016 to really address the nutrition insecurity that Iowans are experiencing. For years, Iowa has ranked very low in fruit and vegetable consumption, and fruit and vegetables are a critical component of the nutrition that each and every one of us needs. So really working to improve access to fruits and vegetables, and especially for individuals who are low income in our state, was a critical component of the work that we do. And so we've seen great success and growth over the years since launching it with 6 farmers markets. And now we're at just a little over 100 locations across the state of Iowa. That does include farmers markets, farm stands, CSAs, as well as working with Fairway and Hy-Vee, 2 of our Iowa regionally based grocers here in the state of Iowa, as well as a couple of food co-ops too.
Welcome.
So this is what you can see, what we had as of the end of 2024, and we are now into 2025, and actually are working to expand some of these locations across the state of Iowa. But the goal really is how do we get more fruits and vegetables in the bellies of Iowans so that we can continue to improve their overall health and wellness, and so that they can live out their healthiest life. So this is a match program. It's primarily funded through private sector funding. We do have a match requirement with the USDA, where the other funding source comes from for Double Up Food Bucks here in the state of Iowa. Oops, I do have another video I will show you actually that reinforces our partnerships with farmers too.
In the heart of America, where the rolling fields meet bustling urban landscapes, lies a program that's transforming the way communities access fresh fruits and vegetables. This is the story of Double Up Food Bucks Iowa, an initiative making waves in both rural and urban communities across the state. Double Up Food Bucks Iowa offers a simple yet powerful deal. For every dollar spent on fresh fruits and vegetables using SNAP benefits, customers receive an equal match, up to $15 per day, to buy even more fresh fruits and vegetables. But what difference is that making in Iowa? Let's take a closer look. In rural areas, where grocery stores can be hard to find, farmers markets have become lifelines. Thanks to Double Up Food Bucks Iowa, buying fresh, local produce at these markets is easier and more affordable. With this program, every dollar spent on fresh fruits and vegetables using SNAP benefits is matched, giving people more money to buy more fruits and vegetables. This means families in rural areas can access fresh, locally grown produce while supporting local farmers. When people shop at farmers markets, their money stays in the community, helping local farmers thrive and keeping the economic benefits close to home.
I wanted to participate because I wanted everybody to be included, because some people are lower income people, and when you allow them to purchase using their adaptive food program and stuff like that, then they purchase the stuff they need. Those veggies, they will not be excluded from getting those vegetables and getting the benefits of those veggies. For example, if they don't have enough cash and they have maybe food stamps or whatever, they can be able to participate in that program and be able to have those foods available for them in an easy way.
In urban areas, the challenges are different. Food deserts and high living costs can make it tough to find fresh, affordable produce. By bringing more fresh, local produce into urban neighborhoods, Double Up Food Bucks is increasing access to fresh fruits and vegetables.
So I think that just reinforces, the win-win-win that really does happen with Double Up Food Bucks. We're supporting Iowa farmers who are growing produce in our states. And really, we've seen Iowa is unique how our program works. We really make sure that it's interoperable so that individuals who maybe are earning at a grocery store can redeem those Double Up Food Bucks at their local farmers markets. And we've really seen a significant increase in the dollars that are actually going through our farmers markets during those peak seasons when we actually are able to grow produce here in the state of Iowa. So really giving people the option and the choice to be able to shop, whether it's at a local participating grocery store or at their farmers markets, especially during those peak months that we have here in the state of Iowa. So this is the 2024 impact that we had across the state of Iowa. As you can see, we had a little over $500,000 worth of economic impact created. I think what's unique again here in Iowa is that we are working with Iowa-based grocers as well as obviously our farmers markets. And so the dollars that are being spent here in the state of Iowa stay here in the state of Iowa versus if they're being spent at a national grocer, those dollars don't necessarily stay here in the state of Iowa. We did serve roughly over 28,000 individuals in 2024 as well. lots of things have changed and are continuing to change for 2025. We increased, so for several years since we launched the program, Double Up Food Bucks, the match was up to $10 a day. Effective January 1st of this year, we increased that match to $15 a day. Obviously, there's many reasons why we needed to do that, inflation being one of that, and just recognizing the cost of fruits and vegetables. So that was an exciting opportunity for us to get more dollars into the hands of individuals who are receiving SNAP or federal food assistance. We've been working very closely with food pantries and other social service providers to really help share information about what Double Up Food Bucks is, how individuals can get access to Double Up Food Bucks, where the participating locations are. We've created several new materials that can be requested through our website, including a number of videos, 2 of them that you just saw, that can also be repurposed and reused to really reinforce the impact of Double Up Food Bucks and providing more information about how to use Double Up Food Bucks, where you can shop as well. So lots of good things are coming in 2025. We are also working on an online sign-up option for people, so that currently right now to sign up for Double Up Food Bucks, you have to go to a participating site and sign up at that point of sale or with your cashier. And we're working on trying to also have an online option for people to enroll so that a card is mailed to them. So that will be coming out in 2025 as well. We've been working very closely with the Iowa Department of Health and Human Services to also just increase access and information about Double Up Food Bucks. So when an individual does apply for federal food assistance, that they're also aware of Double Up Food Bucks and where they can participate or shop to actually get that benefit as well. A lot of advocacy efforts are underway. So as I said, Iowa Healthiest State does not receive state funding for the work that we do. And so we have, for the last, I think, 3 years, been working to try to secure state funding specifically for Double Up Food Bucks. And this really provides us the opportunity then to tap into additional federal funding as well as private sector funding if we're able to have really, again, a triple win when you think about it: private sector dollars, state dollars, as well as federal dollars to support Double Up Food Bucks. So we have a contract lobbyists that we were able to hire through a partnership with United Way of Central Iowa, and are working and have had a lot of great success. Actually, this session, we're getting closer to hopefully securing that appropriation, but it's yet to come. Still a month left in the session, so hopefully we'll have better news in the next coming month of having this appropriation for Double Up Food Bucks. This will continue to allow us to add additional sites, work with additional farmers throughout the state of Iowa, and continue to work on the technology that we've implemented for Double Up Food Bucks. Additionally, we do work at the federal level. The grant that we received through the USDA is actually funded as part of the USDA Farm Bill. And so really working to educate our Iowa congressional members about the impact of this grant and how it impacts Iowans right here in our state, the farmers, as well as our grocery stores, and the importance of continuing to have those dollars available for states like Iowa as well. So our next, really, I would say, healthy incentives program that we also oversee here in the state of Iowa is our Iowa Produce Prescription Program. This really comes down to prescribing fresh fruits and vegetables for individuals that have diet-related chronic health conditions. We've been primarily piloting with diabetics and individuals who have a diagnosis of obesity. So this project really kicked off with a pilot that we did with Broadlawns in the Des Moines area, who wanted to see how did produce prescriptions work and what were the opportunities to actually impact the health outcomes of individuals. And that had great success. And so it really has led to additional opportunities to expand the Iowa Produce Prescription Program throughout the state of Iowa. We have just wrapped up the first cohort of patients where we partnered with providers in Cerro Gordo, Blackhawk, Webster, Polk, Cass, and Des Moines counties to identify patients that would enroll in the program. They all had to have the diagnosis of prediabetes or diabetes to participate in this specific project. And again, really looking at how do we influence those choices that people are making and getting more fruits and vegetables into the diets of Iowans, and then looking at the biometrics and how does that change in your behavior and the food that you are consuming impact your long-term biometrics. And so we've had great success. You can see some of the comments of individual patients who have been able to participate. One of the things that is unique with our program is we have incorporated a requirement for nutrition education for this specific project, just to kind of understand how does nutrition education help with long-term behavior change for individuals who are looking to consume more fruits and vegetables as well. So great success. We're in the process of enrolling new patients in these counties, as well as we have brought on a clinic in Woodbury and Pottawatomie counties. So we'll have additional sites that will actually be participating in the produce prescription program. This program right now is primarily funded through the USDA grant that we have as well to support this work. So our 2024 impacts, you can see here, we had over 210 patients and families impacted. How this program works is the individual receives, so if I'm the patient, I would receive a $30 prescription for fresh fruits and vegetables each month, plus anyone else that's in my household. So if there's, one other person in the household, you would get $60 a month. So just depending on the number of people that are living in your household. The idea is we really needs to be wraparound. It can't just be focused on the individual patient. I think we all know. It's a lot easier when your entire family is doing something versus if you were trying to do something that's different than the rest of your family members. We have great feedback from participants. Over 80% have reported that they've, seen an increase in their weekly vegetable consumption, which is exactly what we wanted to see as well. And you can see the educational touch points that we've had with patients as well. People have been very, I think one of the things that kind of stood out to me surprisingly is that people have actually appreciated the nutrition education that we have provided to them. I think this is something that we assume a lot of people have education around nutrition, but really a lot of people are lacking this. So this has really been something I think that's been a little bit more surprising than not as part of this project of working with patients to really help them increase their opportunities to consume more fruits and vegetables. So 5210 Healthy Choices Count. Have another video. We did lots of new videos this year, so I have to make sure I share them. So I'm going to share this to talk about what 5210 stands for.
5210 Healthy Choices Count is a nationally recognized and evidence-based prevention framework to promote healthy habits. The goal is to increase physical activity and healthy eating through policy and environmental change. The 5 in 5210 represents consuming 5 servings of fruits and vegetables each day to help prevent the risk of some diseases and ensure you're getting enough essential nutrients. The 2 represents reducing recreational screen time like television, video games, and smartphones to 2 hours or less each day. This can improve one's sleep, focus, mental health, and leads to more physical activity. The 1 represents 1 hour or more of physical activity each day. It is recommended to maintain a healthy weight, improve mental and emotional health, and help prevent the onset of some diseases. The 0 stands as a reminder to eliminate sugar, sweetened beverages, and drink more water. People who drink more water and less sugary drinks tend to have healthier weight and fewer cavities. While you might not achieve all the 5210 numbers every day, you can use these numbers to remind yourself to make small daily changes that make you feel good and lead to a healthier life.
So 5210 really is kind of 2 components. I always talk about how it is I'd say marketing campaign and common message. Like I think health information has become very confusing for a lot of people. So really trying to focus on like what are 4 simple things that we can all incorporate into our lives that would improve our overall health. So that's one component of it. And then the other component of it is really looking at how do the policies, the systems, the environments impact the choices that we make every day. So it may be that we want to eat 5 or more fruits and vegetables, but do we have challenges in accessing fruits and vegetables, right? So like, how do we actually connect the dots, and how do we work across systems and environments across the state of Iowa so that youth as well as adults, in all honesty, can really work to achieve that 5210 opportunity.
5, 2,
So in 2024, we've been doing 5210 since before COVID. And I would say with COVID, we identified an opportunity. Obviously, healthcare providers, as well as our schools and early care, really had to make some adjustments. And so really looking at how do we reinvigorate the 5210 work based on working with schools and healthcare and early care across the state of Iowa. We've been kind of in a process of updating and relaunching 5210 and what it looks like. We were able to reach over 3,500 individuals throughout the state in 2024 through tabling and outreach opportunities and partnerships that we have. And I think we have a lot of opportunity going forward to continue to reach even more people. So part of that has been our partnership in working with the Iowa Heart Foundation as well as Iowa 4-H to really start to identify how do we reach schools better, and how do we do it so that we're not doing it each of us on our own, but that we're doing it collectively. I think there's a lot of confusion that can happen in schools, for example, have limited resources anyway when it comes to working on health and wellness. And so how do we actually come together as a collaborative and to actually have these conversations and to make it so it's less confusing. So we've really had the opportunity to work with Iowa 4-H and Iowa Heart Foundation to bring all of the great resources that we all have collectively together to be able to support schools and not make it even more confusing and difficult for them. So I think as part of this, we have a registration process where schools can become a registered 5210 school, and they get access to specific resources through our partnership with Iowa Heart Foundation as well as Iowa 4-H. And so really working to encourage schools to take these easy steps so that they can continue to provide opportunities for education and outreach and learnings for our youth, which is really important when you think about they are the future of our state, and we want to make sure that they can live their healthiest life as a child so they can grow into an adult living their healthiest life as well. We continue to also work with early care sites, so those daycare centers across the state of Iowa. It's really important that they also are building those healthy habits at that very young age. Those habits we make as a child continue with us throughout childhood and into an adulthood. So continue to work with them and streamline opportunities to get them resources and materials to have the conversations and understand the policies that they have in place, even that support whether someone can live out the 5210 motto as well. And then lastly, really working with our healthcare providers. They are that front line. Many of the individuals that we work with across the state of Iowa, the first people that they talk with are their pediatricians. And so how do we work with pediatricians and family doctors across the state of Iowa to adopt the 5210 messaging? What are the questions, the motivational interviewing that they can take with them so that they can talk about 5210 habits with their patients? So again, building those healthy habits across multiple sectors. If you're seeing it in your school, in your early care, your healthcare providers talking about it, kids will start to really pick up and understand that 5210 matters and what are the things that they can do to reach those 5210 numbers each and every year as well. So I think a lot of opportunity continues to exist in this space, and I'm excited for what will happen in the upcoming school years as we kind of learn from what is happening from this current school year and what are continued opportunities that we can provide to our schools, our early care, as well as our healthcare providers across the state of Iowa. And then the last campaign that we have incorporated is our Make It Okay campaign, really recognizing that it isn't just physical health, but actually your mental health has a really strong impact on your physical health, and the importance of making sure that we are addressing mental health as we talked about health as a holistic component. So Make It Okay is a community campaign working to reduce the stigma around mental illness and mental health here in the state of Iowa. We have several different components of the Make It Okay campaign. We have ambassadors throughout the state of Iowa who become trained in providing presentations, doing tablings, providing the information within their own community or within their own networks. As well as we have a registered workplace opportunity for businesses who want to continue to talk about mental health as part of their workplace wellness programming and providing them additional resources and tools to help support those conversations as well. We hosted several community events throughout the year, and part of that is we launched our first community mural in Cedar Rapids, which was really exciting. We've done some other partnerships with NAMI, or the National Alliance on Mental Illness, here in the state of Iowa. Again, bringing awareness that mental health is part of our overall health, and it's important that we're talking about it holistically, as well as when we're talking about physical health here in the state. And then I'll just wrap it up here with, we have several events that we host throughout the year. We host our annual awards where we recognize individuals for the great things they are doing here in our state to improve the health of Iowans, giving them a pat on the back. I think it's important to just recognize health and wellness is not, a sprint. It really is a marathon, and probably a very long marathon that we all are running each and every day. And so how do we continue to highlight the great things that are happening in our state that are moving us in the right direction? And then we have our conference that is also held in April. We're doing those in conjunction with each other this year. And this is really looking at health as a whole, and how do we continue to educate and inform Iowans about the latest advances in health and wellness, the opportunities around physical, social, and mental health, and what people can do to network and take ideas back to their community, their workplace, their schools, wherever they might be coming from. May is Mental Health Awareness Month. We actually just launched our toolkit for the month. So lots of great free resources to, again, talk about the importance of mental health here in the state of Iowa. And then the activity that most people probably would recognize our organization with is our Healthiest State Annual Walk. And that is held the first Wednesday of every October across the state of Iowa as well. So lots of ways that we try to incorporate opportunities to partner with other organizations, such as the Iowa Heart Foundation, to bring health and wellness to the forefront of everyone's mind, and hopefully bring them resources to support them living out their healthiest life as well. So feel free to connect with us. We have lots of information on social media. You're more than welcome to beg, borrow, and steal anything that is out there. That's why we create the information. We want to make it easy for people to have access and to continue to learn what you can do as an individual to improve your own health, but also what you can do to support the community that you live in, and how you can make it a better place for those around you as well. So here's my contact information, and I'm happy to always answer any questions that people have.
Thank you so much for presenting. I did learn a lot, and I did have a quick question. So for the 5210, you talked about how you were trying to get involved with daycares and stuff. And so for schools, can it be any schools from elementary to high school, or is there a limit on certain age groups?
Yeah, so any school can become a registered site. I would say the majority of our resources probably reach more of that elementary to middle school, maybe a little bit of high school, but primarily that elementary to middle school has kind of been our target area for the resources that we do have available for schools.
And our chat is open in case anyone has any questions. So I think we will stick around for a couple more minutes and see if anyone pops in anything.
Yeah, Jami, I just want to thank you for being here, Leslie with Iowa Heart Foundation. And we, as Jami mentioned, collaborate and partner together. And there's so much synergy, I think, that comes from doing this work together. We know that all of the initiatives that you are talking about impact a person's heart health, right? Not just their overall health, but specifically their heart health. And we know that food is medicine. And so we're excited that you were able to share more about Double Up Food Bucks, specifically about produce prescription as well. We're definitely behind all of the work that you are doing, and happy to have you here today. What do you think, if you could pinpoint the greatest opportunity that we have in our state, or if you were to put out there your wildest hope of what we can accomplish together in the next kind of 3 to 5 years, what would that look like?
Oh gosh, put me on the spot.
Hey, and money doesn't matter. Let's just dream big
Yeah.
here. What do we need to do? How do we roll up our sleeves from what you've seen in the work you've been doing so far?
I mean, I definitely think there's a lot of opportunity in our youth space to bring the partners together to really try and identify how do we better support our schools. They really don't have a lot of resources when it comes to this type of work. Some of them don't even have school nurses who often were doing this work, but a lot of times they're getting pulled in multiple different directions. So I think having resources that can actually be plugged right into the school is really important because they just don't have the extra time and energy. But also making sure that we're doing it as a collaborative partnership. So there's so many different potential resources out there. And that's, I think, is what we identified before we entered this partnership with Iowa Heart and Iowa 4-H is there's similarities, but they're different. But to schools, it's like, this all looks the same. I don't know if I should do one over the other. And so I think what we really need to continue to focus on is the infrastructure to get the partners together to best support the schools and not feeling like we need to compete against each other. There's plenty of work to be done, right? And so I think it's always hard because everyone wants their own name, their own brand, they're, out there. But I think we will be more successful in actually reaching kids and supporting schools who need the help, for example, if we can actually kind of put aside the egos and actually come together and say, this is what we want to accomplish and how are we going to do it collectively versus competing with each other. There isn't enough money out there in the world to do this. If we're competing against each other. So I think that collaboration is still really, really critical in all of this work around health and wellness in general.
Yep, totally agree. Yeah, I remember, when I first started here, Iowa State came to us asking us to fund things, right? We met with you all asking us to help fund, right? And so it's always been my vision, my dream too, that we can all do this together. Like
Yes.
there's just, yeah, I mean, in nonprofits, we often live in a scarcity model. And boy, if we can have some freedom to not operate in that space and to do this, collectively together, I think that we're going to get there. So I am incredibly proud of our 3 groups coming together because it was important. And I think along with Emily at 4-H and Sally and the team and everyone, but I mean, I think as leaders, we've all identified that and we're committed to making sure that we're collaborating. So the other question I'll have is just, if you could share what you've seen as barriers to produce prescription or to double up food bucks, and what barriers are out there for providers and how we can help with engagement, and then also the participants, because until we identify some of those barriers, I don't know that we can scale it as much as we need to. So what do you see as the barriers to scaling this?
Yeah, so double up food bucks, I think the barrier, I mean, the limitation has definitely been the dollars, right? Like the more stores you turn on, the more hopefully fruits and vegetables that are being purchased because you're in more locations. So that's always been our challenges is how fast can we scale up, not knowing exactly how much utilization is going to look like. Also knowing that SNAP benefits do change over time, right? So when we think back to COVID time, the amount of SNAP dollars that were in the system was significantly higher than what we are seeing today. So some of that kind of forecasting and trying to figure out like how many stores can you bring on and how many people are going to be using this. It's not an exact science, and that can be challenging, especially if you don't have sustainable funding that is going to support the program. Because the hardest thing that we had to do in COVID when we turned off. So for example, in COVID, we actually turned on every Fairway locations in the state of Iowa because we had additional funding through the governor's office that provided dollars specifically for expansion of double up food bucks during the pandemic. That was great. The hard part was when those dollars ran out, we had to turn off pretty much all of the stores. I think we went from 117 fairways down to 20 fairways. So people lost access, and that's really challenging for individuals who are receiving SNAP benefits, but it's also challenging for our grocery stores. They're having to train their cashiers on how to do this program, what the program is. And so turning on and off is not an ideal situation. So we have been very strategic since then to identify what dollars are available for how long that can help support the program. And having that sustainable funding is really critical so that it's not something that is on today, off tomorrow. There are other states that they call it a winter break, I think is what they call it, where they turn off the program for 3 months in the winter. I don't want to ever have to do that because again, that consistency is really important. And we should be eating fruits and vegetables in winter, just like we are summer too. So I think that's from a double up food bucks perspective. Produce prescription, there's a lot of conversation around produce prescription nationally. And I think the biggest challenge with produce prescription is how do we fund it, right? And so there's a lot of conversation about that it should be funded through the insurance model, whether that's Medicaid, Medicare, and or private sector. Long term, it cannot just be funded by fundraisers and by grants. It's just the model won't work. And we've seen that here in the state of Iowa, where you have one-time funding. That's not sustainable. So I think really trying to figure out what is sustainable, how do we pay for that? And then also the different ways that you can do produce prescriptions. I think the lowest barrier to entry is probably the most important, but also how do we do this so that it works well for the healthcare providers? Those are some of our challenges, just the systems in which they work and how do we get data out of that system has been very challenging for us. So like, how do we make it so that providers are excited about the program, which we have many that are excited and want to do it here in the state of Iowa, but then how do we do it so that it's easy for them and it's easy for their patients to enroll and get access? Similar to, it's easy for people, for the most part, to get a pharmaceutical prescription. So why can't we make it as easy for them to get a fruits and vegetable prescription, to be honest with you? So I think there's a lot of room for opportunity still within the produce prescription platform to kind of figure out what makes the most sense. And is education and nutrition education, is it a barrier to access, or is it an important component of making sure that then people have the information to carry on after that prescription ends? And I think that's even the other question is, should the prescriptions end, right? Often your pharmaceutical prescriptions are something that you end up taking for life. And really we should be eating fruits and vegetables for life. So I think there's still just a lot of chatter around what does this look like and how do we sustain it long term? The outcomes tell a story itself, to be honest with you. People are seeing improvement in their overall health. And when you look at their biometrics, there is improvement, and that's happening in cohorts that are only 6 months long. So imagine what it could be like if this was something that people were doing long term. We could probably see some really significant health improvements if they continue to have access. So I think, produce prescription is not going away. I think we've got to figure out, as well as many others are trying to figure out, how do we make this so that it's sustainable and people have access to it in a way that's not cumbersome like it can be right now.
Sure. Caitlin, did you have any more questions? I mean, I could talk to Jami all day about this stuff.
Not that I know of. Do you have any more questions for her, Leslie?
No, I don't. I mean, I don't think so. I just, again, very thankful that we can share this information out with the community, and just know that we'll be at their conference in April. So Iowa Heart Foundation will see you all there, and we'll work together a lot. So, we're here to support each other and grow that, and we're thankful for the collaboration. So I appreciate that, Jami.
Yeah, thanks so much, and thanks for having me. It's good to see you all.
Thank you so much, Jami. And then I will just share my slides really quick for the upcoming webinar next month. We will be talking about Telehealth 101. So anyone who has attended this one or maybe watching on YouTube, we would love to see you there.